Sir, I'll be presenting about informed consent, sir.
Pardon?
Informed consent,
Informed
sir.
consent. Okay.
Yes, sir. Good evening, everyone. I've prepared the answer from Miller's and online articles on informed consent. So, general introduction. Medical ethics is the principle that respects patient autonomy, beneficence, non-maleficence, and justice. Informed consent is a process in which a healthcare professional educates a patient about the risk, benefit, and the alternatives for any given procedure or intervention. This concept first came about in 1914 after a case in the New York City hospital where the court ruled that every human being of any adult year and sound mind has the right to determine what shall be done with his own body. There are legal or moral imperatives to consider for informed consent, and this is based on the four ethical on the four is based on the principle of respect for patient autonomy. So, autonomy refers to the ability to choose without controlling interferences by others and without personal limitations that prevents meaningful choices such as inadequate information or understanding. Talking about the importance of informed consent, the function of any informed consent is to make sure the patient is fully aware of the medical procedure that they undergo so that they can make an autonomous decision about their care. The different procedures that require informed consent would include treatment, dissemination of patient information, specific procedures, surgeries, blood or medication infusions, and anesthesia. Then we have to discuss about competency and capacity. Competence is any legal determination, legal determination, and capacity is the ability of the person to reach any conclusion based on their rational thinking. The agreement or disagreement with a proposed treatment does not mean that the patient lack or has any specific competency. However, there are special situations to consider, such as lack of comprehension, such as the use of medical jargon, presence of language barriers, and cultural differences. Also, any impairment in capacity due to mental or medical illnesses, dementia, immaturity, anxiety, or due to pain. Older patients and children are especially vulnerable. Hearing loss, expressive aphasia, and neurological impairments can create a false impression that the capacity may be impaired. Patients in severe pain also may not be able to focus and respond. Hence, it's the duty of the anesthetist to ensure that any reversible conditions that interfere with this medical decision do not delay any urgent or emergent medical treatment. The parts of the informed consent, the nature of the procedure or intervention should be discussed, the risk and benefit of the procedure or intervention, reasonable alternatives, the risk and benefit for the other alternatives, and the assessment for a patient's understanding of these elements. To an effective informed consent discusses a thorough discussion of all the relevant risks, which includes general risks, risk that is specific to the procedure, risk of not undergoing the treatment, and the treatment alternatives. Coercion refers to the presentation of an intentional agent or of a real or implied threat of a harm that the recipient believes and alters their behavior. Some additional considerations include one significant issue is that consent forms are written at a reading level that may be too high for the patients to comprehend and hence must be simplified to a language that the patient understands. And the use of visual and digital communication is especially encouraged to improve the efficiency of obtaining the consent. And informed consent may be waived in emergencies when there is no time to obtain the consent or the patient cannot communicate or if there is no surrogate decision maker that is available. So that's it, sir.
That's a very short version of the answer.
Yes.
You rightly said the informed consent has got two components. One is the ethical component, the other is the legal component. We have not taken a proper informed consent and something goes wrong. That is a case where you end up with a investigation from the patient, and the main blame will be that I was not properly informed. For example, you have not told the patient about the complications of spinal anesthesia. The patient develops some back pain or residual neurological deficit, and then he goes to the court of law. You have the patient will first thing the lawyer will tutor the patient to say is the anesthetist never came and saw me. He never explained to me that this sort of complication can happen by giving spinal anesthesia. And because of that, I have landed up with this particular problem. So it is very, very important from legal aspect also to inform the patient about all the very mild to the maximum complication, but at the same time, it should not be discussed in a way that it threatens the patient. Then your surgeon won't call you in future because he'll say you are saying that that can happen to any patient coming for anesthesia, and all my patients are running away because of you. So, of course, the surgeons are the first one to see the patient and they only refer the cases to you. And so they also have the same duty bound to explain the patient about the risk and get the informed consent for surgical aspect. But we as anesthetists have to discuss with the patient about the risk in anesthesia and explain it in such a simple way in his own language which he can understand and make sure that they have understood that also. And the points that have been left out in your preparation are the timing of your informed consent you obtain, how long it is valid. One. The second thing is what are all the, of course, you mentioned about emergency situation where it is that you have to do some life-threatening intervention. Waiting for getting a consent is not a very major thing. It is accepted by the law that it automatically implies that patient has to consent for that particular treatment. And another point that has to be mentioned in the answer is the capacity of the patient. If he is not in a position to give the consent himself, for example, an elderly patient with a cognitive dysfunction, he has suffered a fractured femur and he is disoriented. At that time, you cannot get a consent from him. So at that time, there can be a surrogate person or a family member who can give the consent on behalf of the patient because unless you operate early, the patient is likely to deteriorate and become bad. So that point also has to be mentioned. And the documentation, that is very, very important. That has to be given full credit in your answer. So documentation of the entire discussion and patient acceptance and getting the signature of the patient with time and date and witnesses. That is the most important legal part of the documentation of informed consent. So that only will speak in the court of law that you have explained everything, and the witness should see actually the concerned patient signing the consent form in front of them. Not that you get the signature of the patient and then go out and tell somebody to come and sign as a witness. That is not the correct way. The witness should actually see the recipient of the treatment signing the consent and then agreeing for that. So all these points have to be included in that. So just show you how to modify your answer for that particular question.
Yes, sir.
Otherwise, we have covered mostly what is required in the answer.